All right. Good evening, everyone. I am Marianne East. I'm the Artistic Director for Lifelong Learning and Research at Encore, and I want to welcome you this evening to our Arts and Health Masterclass with Dr. Alan Siegel. I'm actually coming to you from Williamsburg, Virginia, where I'm at the Virginia Governor's Conference on Aging, and I'll be presenting about Encore tomorrow afternoon. So I'm excited about that and meeting a lot of folks. And I want to make sure that we have enough time for everything that Dr. Siegel has planned for us. So I'm going to do a little introduction. Dr. Alan Siegel is a family physician at Kaiser Permanente in Oakland, California, and is working to develop their social prescribing program. For the last 2 decades at Contra Costa Health, he led an arts and health program for patients and staff and led many projects in social prescribing. A Nature RX program to bring patients with pediatric obesity and chronic disease to Bay Area regional parks. And he helped start the Health Leads program at CCH to address social determinants of health. As a National Organization for Arts and Health founding board member, he initiated a project to bring the arts to healthcare workers to address burnout. He also provided leadership to the renowned Martinez Family Medicine Residency Program, specializing in ambulatory education and faculty development. Alan has also completed a UCSF Champion Provider Fellowship to work on advocacy. So we are very excited to have Dr. Siegel here with us this evening to talk about social prescribing and his work specifically with Social Prescribing USA. And I'm sure he's got a great session ready to go for us. So, Dr. Siegel.
Thank you very much, Mary. And it's great to see all of you. And thank you very much for having me. So I get to talk about one of my favorite topics, a topic that is dominating my life at this time. But I appreciate that you guys are here and interested in it. I think it's a interesting topic and kind of hot right now. And hopefully we can see why. So so I thought tonight we would talk a little bit about loneliness, social isolation, common topics with our aging population, social prescribing, and then most importantly, I think how you can get involved. So I will talk a bit about Contra Costa Health. This is where I came from. As Mary said, I spent 25 years of hard labor at Contra Costa Health and got a great opportunity to do a lot of things. So I'd love to share some of that. But I'm going to go back a little bit before that to kind of what lit my fire around this work is that I when I was a resident, which that was my first real job, so it was only a couple of years beforehand. I had been through my own difficult time during my third year residency. It's kind of a fishbowl, and and a hard time and a very intense time, and I ended up going through a major depression, which really did last for about 6 months, as they tend to do, and it was really kind of the lowest point in my life. And it's just really part of, and I did the normal stuff. I went to a doctor within a week and said I'm depressed, and I started taking medications. I saw a therapist. I did sort of all the things, but still, I really suffered with it for about 6 months, which was very, which was intense. So part of my motivation is that we should be able to do better. We have really good tools at our disposal, and I think that we need to put together the left hand and the right hand and be able to put together these things that have already been proven to be useful but are not being used in regular medical care. So that's part of my motivation for social prescribing. So Contra Costa Health. So this is a really interesting underserved system that I worked in. Some of the things I did are that I started an expressive arts therapy program, and through that got to do a lot of interesting things with having expressive arts therapy interns at the bedside. As you can see a picture on the left, we had groups of homeless went to homeless shelters in the community, did trainings for some of our staff. I got to do this weekend workshop program, which is the one on the left lower corner, which was called Stress Reduction Through the Arts. So I worked with a really with an underserved system, underserved patients in a really tough area called Richmond. Some people may have heard of it. There's a lot of violence, a lot of pretty well known for its gun violence. But I worked there, Richmond, and then a neighboring town called San Pablo, where our clinic moved for about 25 years. And so we did this program, and you know, with people interacting with the arts, the level of sharing that people really were willing to do. I did groups for over 10 years now, I guess for 12 years. And I've never seen sharing at that level, just people's real traumas about their children, about their lives. And it just really stuck with me of just what I think that the arts help them be able to open up and be able to share, because I think the arts brings out a lot of vulnerability in people. Some of these other pictures are we had a harp in the ICU and we had wellness classes and did all kinds of great stuff. Um, let's see if I can get down there. Another thing I got to do was we started a program called Healing Through Creativity. And so this was actually one of the first things I did, but we did it for 15 years after that. Had to take a break for COVID for a year or two, but we brought together our staff. This is really a staff event to really work on healing for the staff. And so the staff would get on stage and perform, and they would do dance and music. This is a band that ended up kind of forming out of this as one of our residents, actually. Um, but we would have music and we would have poetry and we would have spoken word, and then we have some of the staff would bring in expressive arts and they would show the stuff that they had created, and we had auctions where people would buy each other's art and hang it on their walls, and people really considered that their highlight of the year because they really got to see the human side of people that they worked with and never really got to see in their normal stuff. And then another program we did was Walk with the Doc that I think Mary mentioned. And we, I was working in pediatric obesity at the time doing groups. And so after about 5 years of them, and I was able to secure some money, we were able to do this program, did some education at the clinics, and then took kids, their families, and other patients out to our regional parks. Now I live in a really beautiful area in the Bay Area, and we have like amazing parks. So we got to go out to these parks. We would have Zumba and yoga. We would have a naturalist. We'd have expressive arts. We'd have live music and healing food, and it was just very powerful. And it was powerful for us as the doctors who came there, and it was powerful for the patients. And the fun part is I got to then hear about it for several years after that, that this was like really one of the most powerful experiences that a lot of my patients had, just being in the community with people doing these special things of walking and being together, doing art together. And I don't know, it just really stuck out with me. So, so that has really kind of educated my time since then. Um, so I'm going to move into sort of social prescribing and kind of well, actually, I'm going to talk about loneliness for a bit and just how important this loneliness and social isolation is. I and I don't know how much you guys have talked about this issue, but it's just such a critical issue, especially with our aging population. But in the last couple of years, there's finally been an appreciation for how important this is. And certainly COVID, I think, really helped bring out a lot around loneliness and isolation. This is an article that came out in 2022 about how much increased risk of stroke and heart attack and death comes as related to people who are at loneliness. This was our last Surgeon General, of course, and he really changed the United States and changed the world by really going on a loneliness tour around the United States for several years, college campuses, to youth, to adults, to really just bring this to where this is now part of the everyday conversation that people really still talk about this stuff. And I think it really did make huge changes. And And he did bring up this idea that social isolation is about around 15 cigarettes per day. And I can show you, this is one drawing. I'll show you another one that shows you kind of all the things we look at. But social connection was actually worse than the smoking 15 cigarettes a day. Those got the headlines. But if you look at all the other things we pay attention to, the drinking alcohol that, we bring up in clinic all the time, people being inactive. We spend a lot of time on that. Obesity, air pollution, um, vaccinations, all those things are below this as far as what we pay attention to. But the top two things on the list, I'll show you momentarily, are about social connection. And so we really need to be paying much more attention to this part. So as you can see here, 29% increased heart, 32% strokes, dementia, death. It's just the numbers are 60% premature death. When I've shared these numbers just casually, my brother's an ER doc, and I don't think docs really pay that much attention to these things, unfortunately. But I was sort of telling him about how impressive these numbers were, and he couldn't believe it. So I think that while everyone's been hearing it, I'm not sure that the medical profession quite gets it, like how seriously this loneliness thing really is. He has to because he's my brother and has to hear about social prescribing. So, and of course, the Surgeon General put out these 6 pillars of social connection and what to work on. And one of these was increasing connection in the community. Another one was really work on changing healthcare and educating our people about it. So the Surgeon General definitely got that. So this was a chart I was talking about. And if you look at, the top two are about social connection. You get to alcohol and you get to flu vaccine and physical activity. Yeah. Anyway, so it's just social connection is much, much more important than almost all of these, but yet we spend almost no time during our visits for most doctors, and I'm probably certainly guilty of it because we have so little time to spend with patients of getting into social connection. We just don't have anything like built around it. There's not like, anyway, it's not like a part of our medical training. We as doctors don't like to ask about things that we can't do anything about. It's just, you should know that about your healthcare. Like we like to work on things that we can feel good about and that we have something to offer. But in general, until prescribing has come along, I don't have much. I previously worked with my social workers at my previous job about the same issue. We were able to get it put on the question, but then people would complain about it. Thing to do. This is not great. And because nobody really likes to bring up problems that they can't solve, especially doctors, because that's what we like to do. Um, so some of these slides I borrowed from a colleague, Dr. Carla Parasinato, who's one of the leading loneliness researchers who's at UCSF. And it really kind of separates between loneliness and social isolation. I think these two are often used interchangeably, but the difference is that loneliness is really your subjective feeling. So you could have all the friends and family in the world, but if you don't feel like you have these critical connections, you could be lonely because it's your subjective feeling that whatever you have isn't really enough. And social isolation is much more of the measured numbers. So how many people are in your environment? How many people, how many family do you have? How many friends do you have? And so that's much more of a number. Um, all right. So looking at loneliness, it's pretty popular. About 43% of adults. Sometimes we hear about half of the people in the United States are lonely. I think if you put all the populations together, that's probably true. 1 in 4 say social isolation, so they're separating that out. And then 73% of teens and young adults, and that's just number is just incredible. I think I was whatever. I worked through COVID, and like the idea of having a 15-year-old come into me and be suicidal, like was something that maybe happened a couple times in my career previously, but it was sort of a common, almost daily thing during that time. It's just the youth really suffered through this, and the effects of COVID are going to go on for a really long time. And this population, I think, who grew up with it not being able to go to school and being isolated and not having their normal prom and their normal things, I think are really going to suffer. And so I think that this is evidence of that, is like that we didn't literally learn how to be together normally. Um, Screens, I can tell you from my own children, are a real hindrance, and they've grown up with screens. And that is, while you might seem like you have a lot of friends, it doesn't actually, it seems to make the loneliness problem worse. So I think we're going to have a lot to do, especially with that population. If you look at risks for it, losses, so Yeah, so losses, marginalization, and being excluded. So a lot of it is just not feeling like you're part of something. Another way to look at it is really uncertainty. So COVID was a big part of that uncertainty. Losing people in your life. So I think that happens a lot with our aging population. People lose their own identities of exactly what they do in the world, how they are. They stop working, they stop having all those connections. So I think that does happen with people in aging. But also, yeah, COVID was an unusual thing. So I think that leads to anxiety. We're not really hardwired to handle anxiety long term. Anxiety was a thing that was built into us to be able to survive for a moment when with the fight or flight. But when people have that ongoing thing, it becomes something that we're just not used to dealing with. And now, it is a really super common thing. And that, of course, can lead to loneliness and people becoming protected and then not really going out and being around people. This is just more evidence of the same. So the only one that's going up here is social isolation. But if you just look over time, this is about 20 years of time, all the markers of people being connected to others, whether it's with friends, if it's with family, it's with people outside your household, they all were kind of dropping off over a 2-decade period of time. But then if you look at the COVID time, those last couple of years, that's COVID and pretty much just really dropped off during that time. So what are the symptoms? So symptoms we see a lot about mental health, pain, anxiety, depression, insomnia, and then physically increased death, 45%. ADLs are your activities of daily living. So how well are you able to function to take care of yourself? So 59% increased risk. Heart disease, diabetes, frailty, and functional decline. And I mentioned death already. And then there's an incredibly increased cost of all of this. 2020, Cigna studied it and they come up with $406 billion, which are numbers that we can't really quite get, I think, but $4,200 per employee. And that and $7 billion of increased Medicare spending because of loneliness. So that's when the government starts paying attention to these things. And this is another way of looking at it is how good are health professionals at assessing people for social disconnection? And so the ones on top, the ones that are lower numbers, which are the higher ones, like social support and social integration, we're not very good at. And then if you look at the right side, we're very good at asking about medications and weight and if people are active and flu shot and all that. So it's kind of another way of looking at what we looked at earlier. So, does it work? So does it work to, I'm sorry. Does it work to actually include social support in treatment? And so these are some numbers that looked at a big meta-analysis is the best way to look at the literature. So this looks at 100 plus studies, randomly controlled trials, which are the best studies. And they really did find not just does it increase your risk, but actually if you go the other direction and if you include it as part of your treatment, then it helps about a 30% longer survival. So that is very promising. Let's see. So and this is really, when it comes down to it, this might be the most important slide. It basically just shows you how only 20% of people's health has to do with anything that I do or that we do in a hospital or a clinic. So that's only 20% of people's health. 80% of it is what happens to them in their homes and how do they live and what do they have food to eat and good. And so what do they do to themselves as far as smoking and all those things? So that's all fits into that 80%. And so all of our dollars are spent on that 20%, whereby most of what happens is really that other 80%. So I just think it's a really important to understand that we're kind of just off the mark. And if you look at the effects on healthcare, about 60% of people are diagnosed with a chronic disease. I mentioned the $7 billion extra that Medicare is spending for lonely and isolated people. About a quarter of hospital admissions are avoidable. About a quarter of US healthcare is preventable illnesses. So if we did these things better, we could avoid these things. And then medications is fascinating. We assume that other countries do it the same, but we spend more on medications than the whole world combined. So these are things that we can look at doing differently. And I love this definition from the World Health Organization from 1946. It's been around for a while, but health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, with that in mind, what if we started prescribing other things other than just medication? We could prescribe something that would help your anxiety and your PTSD and your chronic disease, your diabetes and heart disease with almost no side effects. Much cheaper than anything we now prescribe, can help your loneliness and make you feel more connected to others. So, social prescribing is really a model for healthcare, not sick care. And if you think about our system, we really deal with sick. We put sick people in the hospital. We spend enormous amounts of money. I mean, if you really look at it, we spend, a huge portion of our money on the last 2 weeks of people's lives. But our whole system is built on people being sick. So we care for them when they're sick. We admit them when they're sick, and then we put them back into the same environment they were that made them sick when we're done. And then we do it again, repeat. So, um, but social prescribing, the way it looks at it, is a lot really about more preventive, about keeping people healthy and teaching people how to be healthy and learn healthy habits rather than just treating their illnesses. Well, it does, a lot of it's been found to to treat people with their chronic disease. I think it's just a different way of looking at health. So it empowers people, yeah, and puts the care in healthcare. All right, so there's been a lot of studies that help support this, and part of it is that this research has been coming out. Now, if you take the arts, there have been about 3,000 studies that show the arts to really help people around mental health, around physical health, um, and enough that it's really impressive. And we'll look a little bit at the data later on as far as what social prescribing programs have done, but this data has been out there for a long time. I kind of changed my career. I was kind of doing a lot of arts and health work, and as Mary mentioned, I was on a national organization for arts and health. So I was really involved with sort of the national conversation around this work. And part of what made me shift it and continued to make me crazy 10 years later into that work was that this stuff was only available for a handful of people. That this, that's true 20 years ago, it's still true today, and they do amazing work, but I want this to be available. I want arts and culture and thinking about nature for healing. I want that to be available for everybody, not just a handful of people that now have access to it. So that's the arts, and that's kind of the background that I came from. But it's also true with volunteerism. Volunteerism does amazing things for people. They live longer. Nature really could be as little as 10 minutes a day, but also helps people in similar ways. Lots of studies to do that. Um, all right. And so this is the key question that really it seems to come down to, that social prescribing asks this question from the very beginning. And I kind of love this question because it really is, when it comes down to it, all that really matters. And that is, rather than pretty much every visit where I say, well, I often say, well, how can I help you? But I'm really asking, what's wrong with you today? Essentially, in Spanish, it's ¿qué molestias tienes? So what things are molesting you? What things are bothering you? But basically, it's the same question: is what's wrong with you today? And it turns that on its head and just says, what matters to you, as the question that really matters. And in healthcare, there's been a lot of effort to do patient-centered care, and that's the word of the day, of the decade, to that we're working on this. But we have a long way to go to really pay attention to this. So I think if there's one message to come out of this, it really is sort of turning this to a different way and say, what matters to people? This is a model of how this works. This is out of the UK. And so somebody walks into your office, and you can be a physician, you can be another health professional, and you're assessing somebody, and you say, I think that they could benefit from social prescribing. That could be, it could be really anything. It's up to the physician or whoever is seeing the patient to decide that. But it could be mental health, it could be loneliness, it could be they have chronic disease, it could be you're not sure what's going on, and clearly they need something, but it's whatever you have to offer isn't that thing. So then what your job is to do is to really make that assessment and refer somebody. And then they have this position called a link worker. And the link worker spends time with that person. They ask this magical question, what matters to you? And it's work with people to figure out what brings them joy. Like, what's the flicker? What was the last time that they went, wow, that's incredible, and really figure out what those things are. And then together, that person and the patient makes a plan together. And those plans then go into action. The link worker helps connect that person with things that are happening in the community to be able um, to get that person into all kinds of things that are already happening. So they're called community-based organizations, but they're organizations that are often doing things around the arts and nature and walking groups and those kind of things. And so that is it. And what the National Health Service in the UK, which was the first country to really coin the term and make this a widespread thing in 2018, is that they paid for this link worker position. That's pretty much how they started. There's been a lot of work done since then, but that's pretty much how they got started. And now it, of course, has spread to at least 32 countries. And if you look at a lot of these countries, they really are the ones in around social medicine. So they have socialized healthcare systems. And I think that that makes it a lot easier for a country or a system to look at its people and say, I'm going to care for these people for the rest of their lives. Why don't I invest a little and think about other ways to do things? And so that has been easier, I think, in some places and harder in others. But I think the United States has particular challenges because we're over 900 healthcare systems, and only 30% of our healthcare happens through the government, through Medicaid and Medicare. So most of it is just happening from these healthcare companies. And the average healthcare company, I think, has somebody for maybe 2 or 3 years. I think that's the limit. So they don't often look at long term, what's good for you for the long term. They're really in it like what's going to cost me money now and how do I manage folks. So that is one of the challenges. There's a lot of challenges here, but that's part of it. So so I think when we have a crisis going on in multiple different areas. I think I skipped the slide earlier, but that we have a mental health crisis. I think I mentioned between anxiety and depression, that's about 30% of the population at this point. We have this loneliness crisis, we mentioned it, and really social prescribing is part of the answer. And in the UK and Japan, they have ministers of loneliness. Um, a friend of mine accused me that I'm going to someday be the minister of loneliness. I don't know, but hopefully someday we'll go that direction. And but social prescribing really is the answer to addressing loneliness in a systematic way. We have a healthcare worker crisis. About 20% have already left healthcare in the last couple of years, which is predictable with COVID, and about 25% are slated to leave and retire and get out of clinical work in the next 2 years. So, with social prescribing, I think the doctors can feel good about what they're selling to their patients. I think there can be social prescribing programs for healthcare worker wellness. I'm very excited about that concept and trying to put that into action too. We have a civic crisis. And so this is something that people don't hear about as much, but some of you, might have been more engaged in civic world when you were younger. This was much more normal that people were part of a Rotary Club, or they were part of a bowling club, or they were part of the PTA. Well, so membership has gone down at least a third in the last 2 decades. And this is a problem because there's a guy named Robert Putnam, who's a physician out of Harvard, and he had written a book called Bowling for Columbine years ago. Bowling for Columbine? Bowling alone, nothing for Columbine. Bowling alone. I'm sorry, totally different. And bowling alone. And so basically, it talked about this civic crisis thing, and that, it was a problem 20 years ago, and it has just become a worse problem, especially with COVID. So that people are less engaged. And what he did was he went to Italy and he tried to figure out why some civilizations were very successful and why other civilizations weren't. And he finally figured out that it was the civic capital thing, or civic capital. And people get that by being engaged in their community, and that thing is the thing that we are doing much worse at. So there is a newer movie called Join or Die, which just came out in the last 2 years, I believe, put out by him. So if you get a chance, it's now on Netflix. For a while, you had to actually watch it with people at an event. They wouldn't let you rent it, but now you can actually just rent it on, you can be home alone and you can watch it. But it's basically called Join or Die, and it just documents some of this whole thing. And I think it's just incredibly valuable, especially if you're interested in this topic. And then the last one would be our aging crisis. And so we have a population that is aging. We will have, I believe it's 30% of the population in 5 years will be 65 or older. And and so a lot of less people will work and pay taxes. More people will be have medical problems and need caretakers to help with them. And that we need to start figuring out how to do this better because you know, our healthcare is the most expensive in the world, and it will just continue to be more expensive unless we do something different. So I'm going to talk a little bit about some of the evidence for these interventions. And so what the beautiful part is, and this is about arts, that all of the arts work. And so we don't have to worry quite as much. They've kind of all been studied. So there's a traditional four on the left, big three on the right. So music, dance, all those things are very healing for you in lots of different ways. But so is gardening, so is textiles, so is cooking. So all of them work. And they do really incredible things in your body. They help with the immune system. They help with lowering things like your blood pressure and your pulse and respiratory rate. So things that where your body are needing to work hard. And then they help a lot of other things with ways that we're not going to get into today. But the arts really have been found to do incredible things. And if you look at the data, it's pretty incredible. These are numbers that I can't possibly get through medications or things that I can do, but 44% lower risk of dementia, third disability, a quarter for chronic pain, and a half for depression. I mean, they're just, and this has borne out. So this is not just one study. This is sort of a conglomerate of studies, as well as in the UK, where they have these studies that have studied people their whole lives. They have registries where they've been studying people. And they've really found that, the arts is about as good as what we consider our best thing, which is somebody to do exercise at least 3 to 5 times a week. That's kind of our gold standard for how people do health. And the arts have actually been found to be as good for many of these things as our best gold standard. And this is that's a definition from there, but um, give me a moment. So nature. All right. So nature has been shown to improve cognitive function, brain activity, blood pressure, mental health. Um, and in Japan, one of the earlier ones was forest bathing, but it really, as I mentioned, maybe 10 minutes a week could be enough, that it doesn't have to be a huge amount, but it makes a huge difference. Volunteerism helps uh, slow down a lot of things in your health, decreasing function, depression, mortality, pain intensity, and disability. So volunteerism is also a wonderful thing to do and has particularly been shown to be helpful with an aging population. Community, people that are in community live longer and live healthier lives. There's less chronic disease, there's less heart disease, strokes, dementia, depression, anxiety. So the evidence for all of these is just very strong, and I don't think that we need to keep proving it. what we need to do is we need to prove that it works within our system. And so that's where a lot of the work is now. A book came out last summer, and this area for about the last year, this book came out last June, but about the last year, it's just been kind of going crazy. There's just articles all over the place. Hopefully, some of you have seen some of it or heard more about social prescribing, but if you haven't, you will. It's just, it was just in CNN last week. There was an article in Health Affairs, but I mean, it's just coming out everywhere. But one of the things that happened was the first ever book in the United States on social prescribing came out called The Connection Cure. So if you want to learn more about this, this is a great place to start. It's just tells stories. Julia Hotz, who wrote it, she went mostly around the world because there wasn't as much going on here, but she was interviewed people in the United States as well as around the world about um, people who did, who provided social prescribing, patients who went through social prescribing, tells lots of stories and goes through a lot of the evidence. So there's three parts of the book. And the third one of it, she actually decides, I need to do social prescribing for myself and see what this is like. And so she kind of turned the camera on herself and talked about her experience of doing some of these activities and what that was like. But basically brings it down to these five different areas: the arts, nature, movement, belonging, and service or volunteerism. So I will warn you, is that I'm going to ask you later on. We're going to go into breakout sessions and ask you to do your own social prescription. So if you want to think about it between now and then, it gives you some time, takes the pressure off. But just think about what among these things might be good for you. It doesn't have to be these things. It could be really anything. But what is something that you could do more of that would be healthy for you? And we know that there's good evidence behind all of these five things: the arts, nature, community, movement, and service. And then health equity, certainly something that's complicated in this time, but basically social prescribing, we're trying to, as we build this in the United States, really trying to build this on health equity. And it really does because it involves people and what their own personal needs are. So when they're making these prescriptions, the person is involved, first of all, in kind of co-designing what it is that they're going to be doing in this prescription. And so which, means that it looks at what are their needs. And a big thing around health equity is that everyone is different and what their needs are different than every other. So it's not giving everybody the same thing. It's giving everybody what it is that that person needs. So it's much more individual. But social prescribing helps people access social services. It promotes new tools for self-care. So it's very much around equity. I'm going to skip this. So I'm going to talk a little bit about some of the programs to give some examples of things that are already happening in the United States. I think it's just important to know that this is not a crazy concept. This is already happening and is going to be happening more. And I think, unfortunately, the slides that I'm sharing with you are not the most updated. Um, so one of they just, in the last week or two, there was a really important article that came out in Lancet magazine, which is British, and basically with an accompanying article that came out of the University of Florida. So University of Florida has been the longest program in arts and health and is the biggest researcher around arts and health in the country. They've been doing it for, I think, 40 years now. And so they put out this article and studied these 23 different programs that are all very different. Their interventions are different, how they do it is different, and basically talks about how those are done. And some of the I think most of the programs I'm going to talk about are in that paper, but then it also brings up a lot of new ones as well. So if you're interested, it's also worthwhile sort of seeing it live, how it's happening. So Project Connection is a program out of Salt Lake City, Utah, and it's run by a woman named Lenny Knowlton, who's one of my core people working with Social Prescribing USA. So I happen to know more about it, but it is therapists. So they have, how many therapists? They have 40 therapists. They have 5 link workers. And what they do is they connect the people who are identified that they might benefit from it. They go through the link worker just like they do in the UK. They're trying to actually use the model in the UK. And then they connect them and they really ask the question, what matters to you? And and that may not be that they have a community resource that's already there. They might, one of the examples that Lenny had given me one time was about somebody who was an amputee and really needed an amputee group. It wasn't one of their normal things, but they worked it out to connect that person. That person ended up getting involved, ended up helping to lead that amputee group, and it was just very healing to find people that were suffering with similar things. So one of the Lenny is coining a term called relational social prescribing, and where she takes that, the regular social prescribing is that she has the regular thing, and then on top of that, really wants people to be involved and be part of it. That the real superpower in it is not just being a passive participant, but actually then getting involved and really volunteering is what it is, but basically, doing something to then have a role and help others. That in all of this, that's where you get real change. And so I can see that, and I think it's just putting together different parts of it. All right. So this is another program called Parks RX America. And this is a program that where mostly it's doctors who prescribe in the room with a patient. So they take about 2 minutes. There's a whole database out there, about 15,000 parks, which is going to be going up to 30,000 parks that are connected. And you just have to register. Your doctor does, or actually you can do it yourself at home. And you can make your own park prescription. And so there's I think about 2,000 doctors who are signed up for this, and they can just write out a prescription for people. And so this has been going on for a while. People will get texted to remind them. If they click on it, that feedback can go back to the doctor. So it can be something that is done. This is a program out of Oakland where they take kids out to the parks uh, every week, and it's one of the earlier programs and do a lot of great research on it. This is called Carrollty. And so Carrollty is an organization that is international. I believe it's Colombian, but they do this in 10 different countries. In the United States, they do it in Florida and Tennessee. And they have now actually given out 250,000 social prescriptions. And one of the things I love about them is that it's not a one size fits all. If people can just be given a list of resources in the community, then that's what they get. If they need a little more hand holding to be able to like connect them with those specific orgs, then they do that. If they really need to drive them and work out all the barriers, then they do that. So they have 3 different levels. And then all of the interventions are actually free. And so it's all things like the library and things in the community that are free classes and free things that are happening. And that's just a really nice part of it because one of the obvious things of these interventions. And hopefully, eventually, when we get good data, I do hope that our health insurance companies see this as an intervention, just like a medication or just like a therapy, and pay for these interventions in the community that are just way cheaper than kind of things they're paying for now. But that is, we need the data first to show that that health insurers can save money, and we don't have that in the United States yet. That's called return on investment data or ROI data. So there are people working on. If I compare that to Canada, Australia, and the UK, they all have return on investments anywhere between $3 and $8. So every dollar they invest, they get back $3 to $8 in their return insurance company, and say not only is this the right thing to do, but you actually can save money even in the short run by doing this. So art pharmacy. So art pharmacy is an interesting one as well. This is actually a business model, and they're basically bringing together social prescribing and arts and health, and so art-based social prescribing. So what they do is they kind of act as the link worker, and they have a computer program, and they do a whole intake and assess what it is that people might want to do. And then they have a whole list of things that are happening in the community and they make suggestions. And the people get one dose per month of the arts. And then that information, once the person goes and does the thing, that goes back to the computer and sends it back to the person who prescribed it, and they get feedback about how did that go. And then if they want to do the same thing, they can do it again. If they want to do something different, they can choose another intervention. So, and then after a year, if they want another one, they can get a refill on that. So just like medication. And again, I'm not making these numbers up. The numbers end up being just they blow my mind when I see them because, 85% of people improve who are depressed. Like our medications are just not that great when, if you compare them to some of these kind of interventions. Decrease in loneliness by 2/3. And so I work in Kaiser. They very much are interested in provider set and people, being happy with their experience. But 94% provider satisfaction and then satisfaction out of doing the whole thing. So art pharmacy is now spread to the state of Massachusetts. That is, Massachusetts Arts and Cultural has developed relationships throughout Massachusetts, and art pharmacy is helping to run their program and helping work to be able to study that program there. They started off in Atlanta, that's where the business is located, and have made it out to Stanford. I'm out in Northern California, so they made it out to Stanford, working with the undergrads in a wellness program. They're getting ready to start a program in Connecticut and in New York. And so they're kind of working on stuff all over. Cleveland Clinic, they have a program between the wellness department and the geriatrics department. A lot of what they do is referring people out to nature. And so they do have an arboretum. Sometimes they just give tickets for you and could be another person to come with you if a companion. And they've also connected with some arts interventions as well. Dance for PD, I have a real warmth for this program because this is essentially already part of our healthcare system. So I would say that neurologists, when they're referring people for Parkinson's disease, that dance for Parkinson's is really just part of their established what they offer to people. I yeah. I asked a patient recently whether they had been referred, and they're like, yeah, my doctor doesn't think I can do it. So I was really disappointed. But anyway, I think standardly that this is part of your medical treatment if you have Parkinson. So here is an arts intervention that is already part of our healthcare system. All right, so I'm going to shift and talk a little bit about Social Prescribing USA. So we started this a couple years ago, and with really the it I joined together with two others and we founded the organization. A guy named Dan Morse had looked over at the UK and said, they're doing this thing. They're addressing loneliness and we're not doing anything. We have a big loneliness problem. Why can't we do what they're doing? And started asking those questions a lot. And to really anybody that would listen, he would bring this up and he would start having happy hours and bring people together. And so we kind of built on that and we have developed a nonprofit that is doing this work, and our goal is to really make this part of the United States healthcare to all Americans. We set a goal of 2035. That is obviously optimistic, but the plan is to make this available so that this can be available. Um, Equity, I mentioned. We educate. So if you're interested in this topic, we put together information from all over this. This is a complicated thing and involves a bunch of different stakeholders. So we try to look throughout and kind of what are the latest articles that are changing things, and we put those together in a newsletter every month. So if you want to sign up and do one thing after you buy the book and read about social prescribing, this is a good way to keep up with what's happening and what media is happening and all that. So there's a newsletter. We have a website, socialprescribingusa.com. Lots and lots of evidence there. Social media, we do a lot of social media on LinkedIn and Facebook and trying to let people know what's happening. And then we're doing a mapping I think I skipped the mapping slide earlier, but let me see if I still have it. Yeah, I don't. But we're doing a mapping project to truly get our hands around like what's happening in the United States after all. What what who has programs? There's a lot of things that are calling themselves social prescribing that maybe aren't, and there's a lot of things that don't use the term social prescribing. And so we're trying to find all that stuff that is happening and be able to put it onto our mapping. We're using the definition of some connection to healthcare or healthcare professionals as how we're kind of what we're working on. But social prescribing can be your church. You know, your church has an event that has people get together and do something that, that is a form of social prescribing. And eventually, I hope that everyone is doing social prescribing all the time. How we think that we can advance this in the United States is really trying to work with the healthcare system to be able to kind of pay for some of these interventions and really make it widespread and available for everyone. So some of the things that we have done are that we bring together, we have a community of practice that's about 270 people at this point, and there are people all over the country. Some of those people have programs in social prescribing, some of them are artists, some of them come at it from different angles. And we're working with people to try to see like what parts are they missing and how can we network people and do that kind of thing to be able to support people to have more of this work around the country. We also have a health professional champions group, and so we're bringing people together in order to say how can we learn how to advocate for ourselves and be able to um, talk to our legislators, talk to our healthcare systems, try to make this happen. So we're trying to train people to do that. We have lots of webinars and events. If you go to our website, we've been putting stuff up there for a while, so we've had a lot of programs, and you can be able to watch some of the national experts and leads in this work. And then, we're working on trying to figure out what are the best practices, so that we can really be a leader in the world. So, if you want to get involved, I mentioned join our newsletter. You could join our community practice or our health professional champion group. You can, that is now passed, but we just had a social prescribing day in March, and we had a webinar. We had one involved with the New York Fed is involved with this. They have a work group working on it that we're part of, and so they had their own webinar. And and yes, you can contact me as well. So things on our website that I didn't mention, yeah, our evidence library. So if you want to kind of look and see what's proven for these things, there's a pretty good in different parts of it. So for dance and movement, for the nature, for social connection, for all those things, there's pretty good evidence there. This was a slide about the Lancet article I'd mentioned, and this is from their University of Florida. This was another program. The slides got a little bit out of order, but this is a program in the New Jersey Performing Arts Center. This is one of the first programs in the country. And this is where insurer, Blue Cross Blue Shield, connected with the New Jersey Performing Arts Center. And so they took patients who were high utilizers, people who went to the emergency room a lot, or they went to clinic a lot, or they had a lot of diseases or a lot of mental health, drugs, alcohol. So it tended to be people who just needed a lot of health care. And they took those folks and they connected them with the New Jersey Performing Arts Center, who has relationships with a bunch of other nonprofits in the arts. And they send people to do interventions and came up with some really good initial outcomes. And then they just got a grant last year for $150,000 to expand their program from the NEA. So that's usually a sign that you're doing well. This is another program in New York from the UJA Federation. So another combined Norwell Health connecting with aging folks who are at home and assisted living and nursing homes, and they provided the connection specialists and really concentrating on connecting people from their loneliness. This is a resource in that people can get a hold of called Arts on Prescription if they're interested in starting programs. It has a lot of ideas for ways to do that. And unfortunately, well, I just have to skip through some of these slides because there are some doubles. But this is a program called Open Source Wellness. And I love this program because, uh, first of all, the person who was one of the founders, her name is Elizabeth Markle. If you get a chance, she has a TED Talk called Community as Medicine. And I think it's a very powerful thing to just think about that concept. And so I think it's 15 minutes or so, but it's definitely well worth spending it. And she developed a program based out of Oakland, but that has now doing work around the country through YMCA's as well, where they use the health coach as a center point in their groups. And they have groups, and the groups do food as medicine, they do movement, as you can see, they do mindfulness, and they do some individual health coaching. And here are their outcomes. Again, these are hard to find outcomes that are this good in anything that we're doing, but um, lower blood pressure, increased physical activity, less depression, 77% decreased emergency room visits. So yeah, Walk with a Doc is another program that physicians um, go on walks with patients out in the community. And so I got to do this. This was how I did my program, but there's 600 communities, 39 countries where people are doing this. So this is a simple way to start a program that I think can be super healthy, both for the doctors as well as the patients. Um, this is another worthwhile program called the Compassionate Contact Corps. Um, Lori Murphy started this program, and they actually have. So this is for the VA. So the VA, if you can think about what happened in COVID, they closed up all the VAs, and this is where all the vets hung out for a lot of time. I can't say all the vets, but this is where a lot of vets would hang out and spend their time, and they'd talk and tell stories. And suddenly there were no more VAs for people to hang out in because they closed them up for COVID. And so they were having serious problems with their loneliness. And Lori started this program, as I said, has now spread across the country, where they would have a volunteer, and the volunteer would call one of the vets and spend between 15 and 60 minutes once a week and speak with them. And that's it. It's a simple program, but their outcomes were pretty incredible as far as helping people with loneliness. So that is another example of a social prescribing program. Here's their outcomes: 83% less lonely. But one of the numbers I like here is the volunteers. So the volunteers also increase their own well-being. So 82% of them also improved. So it's not just good for the, noted patient or client. It's actually the volunteer is also getting a lot out of the program too. So I love ones that are cross-generational and ones that where both parties get a lot out of it. And yeah. So I think we will now, if it's okay, to break up people into, so I don't have, yeah, I don't have a slide here. Let me just stop that for a second. So I would love for people, I've been talking enough, and I would love for people to, how many people do we have? 27. So let's break people into a room, and I would love for you to think about introduce yourself. How did you come to be here today? And think about each person take their term and what could you do to do a social prescription for yourself? So that could be the arts, it could be nature, could be volunteering, could be social connection, could be movement, could be anything really that, you know, brings you healing and joy. A lot of times we don't do those things, even though we know I love to dance and I don't get to do enough of it, but a lot of times we just stop doing it, especially when people are depressed. When I was depressed, I stopped doing anything that was like healing for myself. So So good to remember those things. And if people could share that with each other, and then you can alternate in the group, and then we'll come back and how about 12 minutes? We'll come back. And if you want to share your social prescription, you can. If not, then we'll finish up and we'll open things up for questions.
Do we still want to do about 2 to 3 people per room?
Yeah, I think that would be good.
Okay.
Marianne, how do we do that?
So
I think
I'm going to create them and you should all get an invitation to join a room in just a moment on your screen and you just click the OK and it'll magically, it's like Harry Potter. Magically you'll go into a different room and then when we're all done, I'll send a little message and it'll magically bring you all back. Okay?
Thank
we'll
you.
see you shortly.
Absolutely. Here we go.
So it's asking me to join a breakout room. Do you know, are there three people in each? Are there, if I don't go, will there be?
Um, some have two, some have three. I
Okay.
have one that's got one. Room 5, is that the one you were asked to join?
At room 8.
Okay, because room 5 only has one. That could be because somebody hasn't gotten there yet.
Okay.
Yeah, room 8 would only have one.
Okay. I'll go join them. Sure.
Okay.
Okay.
All right, I'll set a timer for 12 minutes.
All right. Thank you.
The rest of you that are still in here, have you received a invitation to join another room? It should be up on your screen and you should be able to click just join. Helen and Nancy, have you gotten an invitation to join a room?
Yes, I have, but I declined.
Oh, okay.
Hello. Welcome back. I think we're still waiting for people to come back. Mary, do we still have people in rooms?
Nope, they're all back.
Okay. All right. Well, welcome back. Anybody want to share their social prescription?
Well, what we found, I think, in our group is that we're all already in the corral. So that was kind of, a natural thing that came up. Uh, and we had only two other people in our group, so they can speak for themselves. But we kind of gravitated also towards book groups and things like that, that were not exactly art, but and we all liked walking. Uh,
Mm-hmm.
but some of us decided that we also need to walk with other people and not just walk by ourselves. Um, but that was kind of the gist of the conversation. One of the things that came up that maybe you can address is has anybody done anything on the effects of Zoom um, communities? Do they have the same effect as if you go out and go walking with somebody, or physically engage in an art community? COVID forced us onto Zoom, and we're
Yeah.
all in groups now where it's just more convenient to be on Zoom, and we just
Right.
hate to go out at night or find parking or, stuff like that. So,
Yeah. I mean, my understanding about it is that it that it is still good and that, Zoom, I don't know whether they've been compared. I would imagine it probably has been studied, and it's a really good question that I will definitely find out, and maybe I get back to Mary and she can share with you the answer to that. I would imagine that being in person is better, but I don't know that from an evidence standpoint. But I think it's about community, and however you create community is really that I'm not sure that that matters as much as the fact that you're in community. So
Janet
I
and I
love
would,
it. Yeah,
yeah, Janet and I were talking about the same thing, how we got involved in Zoom groups during the pandemic. And
yeah.
I also shared that Encore University, which Encore started during the pandemic, was a lifesaver for me because it was all online classes. I learned a lot. I had a schedule every single day. It really prevented me from going into a depression.
Mm. Jerry, you have your hand up.
Yes, I raised my hand because of the question about the Zoom. The first year of the pandemic, I was very happy because it didn't hit until the summer, spring and summer. So I spent that whole summer gardening, but
Mm,
I also learned how to, I contacted with so many performers
Mm,
over using an exercise group using my phone.
mm,
And then when I started doing Zoom, I got a little bit down and lonely later on because when things started easing up, people were not going back out. But
mhm,
just in the last year, I have found a group of women. We meet every Monday. Have not met in person, but we have Zoom and we look forward to it and we talk and we share stories about our grandchildren, our great grandchildren. We write we write about our past. We have prompts so that we do like poetry and things like that we write ourselves. And it's been a lifesaver for me. It stopped me from feeling like I need somewhere to go. I need something to do. But I also um still go out and and the Encore group that I joined this year was something to help me have an excuse to get out of the house. Some place to go that was planned, not just, oh, I'm going to get up and just walk outside, which wasn't as exciting as going somewhere to do something that was planned.
mm.
that
So
sounds
yeah,
great.
the Zoom really, really was a lifesaver, and I think there's no reason to abandon it, but I think it's just as good.
Yeah.
Well, not as good, but
Yeah, I don't think
it's
we
really good.
I don't know that we would have thought that. So it is one of those good things that, or those things that came out of COVID that like has a lot of, like life without Zoom now. I can't imagine because I have so many meetings with people across the country that
Right, I'm meeting
that would
people
never
from
happen. Yeah.
well, some of the people in my group. I'm in New York. We have someone in California. We
Mhm.
have someone who comes from France. They're Zooming with us at the same time.
Right.
Mhm.
And we're sharing our experiences
Yeah.
through conversation.
Jerry, I had a similar
Yeah.
experience with Zoom over during COVID. I hadn't used it before, and seniorplanet.org is an organization that has online classes on every kind of technology, but they also had exercise classes. And there are literally hundreds of people that every morning at 10 a.m. are doing a morning stretch together all over the country, 400 people at a time. And I was even thinking about doing it tomorrow, even though I belong to the Y and I do other kinds of exercise. I happen to need to be home. And so on those days when I can't leave the house, I think it's fantastic option. And I do feel a sense of community when you're doing it with that many other people.
Right. And I do have an exercise group. The physical therapy place closed because they don't want us to be in close contact. So the instructor had Zoom classes where he could see what we were doing. And he did the demonstrations, and in a group we just did our exercises and things like that, and we kept it going. And I'm now their tapes is not as active on Zoom, but we have the recordings that he plays, so we can still do the exercises.
Right. Yeah.
Right.
Yeah. It's a real blessing.
Some good things came out of it.
Yeah.
Mhm.
Thank God for that. And I didn't mention encore. I think the fact that it sounds like most of you sing with encore choirs, I think that's amazing. I mean, I think choirs hold a special place in my heart because you're doing music, you're in community, you're sharing in ways that that I just think are really good in so many different ways. So I love that you're all doing that. And so obviously I'm preaching to the choir a little bit since you guys have, oh, I'm sorry, that was terrible. I didn't even mean it until I said it, but I was like, hey, that's pretty good. Anyway, but yes, I love that you've all seen the light of how powerful that is. And I personally had been in a chorus before. I'm a musician, and I kind of want to get back into it because I just think it was such a good experience. I would love to open it up for questions if anybody has questions or if people want to share about their own social prescriptions too. Yeah, Allison. I think you have to unmute it though. Yeah.
Well, I've been through quite a few medical challenges in the past year, so I felt there was a period of time when I felt like my social life revolved around going to doctors or physical therapy and stuff like that. But it occurred to me, I wonder if sometimes people do actually go to the doctor because they're lonely. It's somebody to interact with.
Yeah.
So,
I heard a statistic today in one of our sessions that in just this Williamsburg area, people call 911 to talk to someone because they hadn't talked to anyone in like months. Yeah.
Yeah, I think the studies that I know about, at least are in the UK, and that it's like 1 out of every four visits was a social visit. And so they have a limited number of doctors and limited, I mean, I guess we all do, but they particularly have limitations. And part of what drove them to get into social prescribing was just a serious need. They didn't have enough doctors for all the care. And so they needed to figure out another way to help care for patients. So when they realized that 1 out of 4 visits was just totally unnecessary and that we could figure out something else to do. But yes, I think that that's a big thing that people want to talk. And I certainly have had that experience where I have no idea why this person's here, except they just want to talk. And yeah, I've gotten better at asking about whether people are lonely, but I'm still not very good myself. I think that we need to do it as a system. We need to really be asking everybody, especially if the answer is that half of the people are lonely, then the answer is going to be yes all the time. Any other comments or questions?
Well, just for me, two other good things that came out of Zoom. One was Encore related because one of my Glen Echo Encore Rocks friends, who's calls herself an extreme extrovert, formed a Zoom group and invited me to join it. And I'm a little shy, and so as a result of that, I now have a circle of friends, or about 8 or 10 of us that get together in person. We don't do Zooms anymore. We see each other at Rocks rehearsals and concerts and so forth, but I think a lot of us, it's kind of hard to spend enough time with the other person to really get to know them unless you see them in some other place. Like the ideal thing or the institutes like Chautauqua and or the trips. I've been on a couple of Encore trips, and you also have a chance to get to know people a little bit more deeply. But the other thing that happened to me with Zoom, and I don't want to take up too much time because I did that during our little breakup group, but um, going into Zoom, I thought, at last, I'll do this family history writing I've been wanting to do since I retired in 2010 and inherited my mom's files. A year later, I hadn't done anything, but then I heard that this woman over in the UK, who's a genealogist and expert on house history, all these English people buying, grand old houses and wanting to know who lived there and
Mhm.
history of the house. So she writes those up. Anyway, she had to go to Zoom, and I heard about her course. And so for 4 years, I've been taking her course. I've written about 150 biographies. I've started turning them into books. Last year, a 2-volume bio of my mom. Um, and I'm the eldest of 6 and kind of vetted my chapter drafts with my siblings. And that was a very interesting experience because, different siblings have different perspectives. And then 2 months ago, I finished this book about my great grandfather. I'm going to be in Kentucky in a few days and meeting with a cousin who's his granddaughter. She's, just one of her, either her dad or one of his brothers fathered a child out of wedlock in Kentucky in the year 1928. And I already asked this one cousin, who's the one human being in the world whose DNA could tell if it was her dad or our great uncle, my great uncle, her uncle, who fathered this boy. And so I just thought I'd write this book first. And then if she does test and we find out who the dad was, then I'll do a revision of it. Uh, and include that information and share it with the family of Wayne Cooks. He died in 1981, but he had 3 children and several grandchildren now who'd like to know who Bio Dad was. So anyway, that drove me to pick his story first, and next I'll do his wife.
Mhm.
Yeah.
That sounds great. Yeah, I love how more people are getting into ancestry and
Yeah.
figuring those things out. And someone asked in the side, and I don't have all the answers, but I at least know of as far as what other resources are there for people around loneliness. I know of an organization here in the Bay Area that I love called Front Porch that does virtual work and that anybody can do from anywhere. So that might be a good resource if people want. And I'm sure there are a lot. I should have an answer to that question. It sounds like Encore probably does a lot of stuff, but I can certainly get back to you with some other ideas because I'm kind of doing that research now as far as what's out there for people as I'm looking to try to create uh, a pilot at Kaiser. I'd like to be able to have access to sort of for people who can't get out of their house and all that of what's available for people
Yeah.
virtually. So
So
I
I have a question organizationally as Encore. How do we become a resource for these other projects that are out there connecting people? How do we become on their list of places where they can refer people?
Wow.
Yeah, no, it's a really good question.
Oh.
I mean, you know, we are trying to figure out how to help people um, connect better. So, I mean, we have this large group of people, and we've been having a meeting. People have been kind of talking about their programs each month, but that's only serving a small portion. But all these people are somewhere, and we want to figure out how people can do things in more in their area to be
Mm-hmm.
able to connect with organizations like you. So I would say joining the community of practice, we're going to be like, we're trying to figure out how best to connect people. We're probably going to have sort of a password protected website where people can go and be able to find out who else might be in their area to be able to connect with other programs. So that is one way that I can answer. But I think it's a really important question to figure out how to connect because there's a lot of people doing great work like Encore out there. And so one of the things we want to be able to do is to be able to have that be available. I mean, one thing that I'm going to look at doing, like there's a program called Unite Us that is a resource database, which, yeah. And so I'm going to look at how do we add some of these arts and nature and other resources to this Unite Us, which is a national program that different healthcare organizations subscribe to, and be able to make them part of that so that when they look up stuff that these other artistic things and nature things and service things come up as options for people. But it's a good question.
You had a slide that was up at one point. I don't know if it was the British health system, but when you didn't have enough doctors, you also had kind of a connector. I'm thinking that what we could do is try to get on the list of connectors, unless that was just in England. I can't remember what that slide was.
Something we're trying to figure out here too, of how do we do it here. I mean, the link worker is something they've sort of developed, but I think is something I'm totally trying to emulate, because I don't have a half an hour or an hour to sit with somebody and really like dissect into like what are the things that bring you joy, and really like get at a granular level, and what are the barriers? Why don't you do that already? Like, is it transportation? Is it childcare? Like, what are all the things that it, so I think there's a great role, and I love that to be a thought of something that if you have more time to be able to do that and you're looking to volunteer, that could be a great way to volunteer and think about becoming those people who are doing, I mean, what is incredibly important work. So we're trying to work out, ways to be able to get people trained to be able to do that, and all that kind of thing, because I think there's skills that, there's some part of it is skill sets to learn. But I love that. I think that's a great way to help people. And so as we roll this out and try to figure out how to make this look in the United States is a totally different thing. I think having volunteers be able to be that role is a really great solution. Right now, we're looking at social workers, we're looking at community health workers, I'm trying to build this into systems so it's not on the back of volunteers, that it's not, it's not from just people being nice. I want to build it in. I feel like healthcare is where a lot of the money is in this country. We've chosen not to give it to social services. We do social services through healthcare. So it feels like healthcare is the right place of who should be paying for this, instead of, making choices that are good choices.
My daughter teaches in the School of Social Work at Catholic University, and I think she would appreciate having something like that to use as part of her syllabus as she teaches the students.
Okay. Yeah, I mean, part of having a health professional group is that I want all of these health professionals to go back to their own student programs and like teach about this concept. I think that, just some of the conceptual parts of it are kind of new to us, I think, in some ways, just of a different way to think about things. And so, yeah, we have an intern who is a social work student, and I am definitely thinking about how to bring this back to the educational programs for all these folks, including medical schools as well. Yeah.
Great. Well, we're at time. So, Dr. Siegel, if you want to wrap up.
Yeah, I mean, you guys have been a great audience, and I appreciate you staying with it for an hour and a half. I certainly didn't want to talk all that time, and I'm glad we got to like break things up. I hope that worked out okay to go into a room and think about your own social prescription. I don't think that unless we really think about it that way, we can get other people to do social prescribing. So I really think that it starts at home, and I'm, with my own unit, I'm looking at having my staff possibly do nature prescriptions for ourselves, and then we can think about giving it to others, because it's just, I think you have to buy in. And that's it. But you have all already bought in, and so you're already doing a choir, which is a powerful thing. So I thank you for having me today, and yeah, good luck with all your singing and learning.
Yes, thank you so much, Dr. Siegel. We really appreciate it. And thank you, everybody, for being here. There will be a recording that'll be up on our website. So if you want to come back and listen to anything again, or see any of his slides again, you can come back to that recording as well. So thank you so much, and have a great night, everybody.
Thank you very much. Bye-bye.